San Gabriel is a city in the San Gabriel Valley of Los Angeles County, California. Some notable landmarks include Mission San Gabriel Archangel, Vincent Lugo Park, and its many boba tea establishments. San Gabriel was founded in 1771 by the Spanish, and since then, the city has grown into a thriving and diverse community, the majority of which are of Asian descent. Through this project, we had the chance to speak with various people who call San Gabriel their home. Through their voices, we want to highlight San Gabriel's cultural diversity and the impact that it has on the safety and health of the community. Housing burden is defined as spending 30% or more of household income on housing. About 48% of San Gabriel residents experience housing burden. This may lead to overcrowding, which occurs in 12.1% of renter-occupied households and in 7.1% of owner-occupied housing. We spoke to a community member, Denise Hui, who highlights her current housing situation as a San Gabriel resident.
Now there is about 7 of us in my household. And I do think now there is a little bit of an overcrowding issue in this area. It's just really expensive. Used to be like $800 for your own 1 bed, 1 bath, whatever. Now it's like you're looking, if you're lucky, maybe 1,800 or possibly a studio. Like a lot of my family outside of my household also have to share rooms, like my cousins and things like that. And then also have friends who also have to like share.
According to the LA County of Health, 62.2% of San Gabriel is made up of the Asian community. In the US, 250,000 people are chronically infected with the hepatitis B virus, and half of those infected are Asian and Pacific Islanders. The majority of chronic hep B cases were estimated to be in LA. Dr. Jonathan Chung, a pharmacist at CVS San Gabriel, mentions how hepatitis has affected San Gabriel residents.
With my population at my pharmacy, obviously you're going to see the big three: hypertension, high cholesterol, and diabetes. But because I have quite a significant population of Southeast Asians, we're also going to see a lot of patients who are infected with hepatitis B, sometimes hepatitis C. And yeah, I think those are the main ones that we're talking about. With the younger generation, people, millennials and younger, unfortunately, we're seeing a lot of anxiety, a lot of depression, a lot of mood disorders.
Okay, so with hepatitis, you mentioned that it is kind of bigger in the Asian community. So do you see that you provide more preventative medication, or would you say like after active infection, or do you also provide like vaccines?
Yeah, so for a good number of patients who immigrated here from those Southeast Asian countries, a lot of them are unfortunately infected already with hepatitis B. So we do give post-infection medications for people who are born here, those who are at risk, and even those who meet the CDC guidelines. We do provide the hepatitis B vaccine, also hepatitis A. So you can get them all at CVS Pharmacy.
Neighborhood violence and crime can heavily impact the health of a community. Thanks to the San Gabriel Police Department, there have been enormous efforts to keep the city of San Gabriel safe. However, many of the calls they receive pertain to mental health concerns and the unhoused community. Sergeant Nat Hyun shares what resources the SGPD utilize for these calls.
A lot of times there's lack of resources. So it's hard. Even when we deal with the mental health, this hospital, they're out of beds. Or this hospital doesn't have a psych ward. Or this hospital, they do have a psych ward, but they're 30 miles away. So these are things we got to bring into play, which kind of like puts a kink in some of the thought process. But there are plenty of resources. We have a mobile system right now with the county. So picture this. There is a mobile truck driving around and stations itself at certain locations every now and then. We'll call it just a rough estimate. Every month it goes to a different location. And what it does is that mobile truck offers free showers, free medical care, but basic. We're not doing heart surgery here. Yeah. We're talking basic medication, and other resources, like they'll offer food, clothing, and direct them to the nearest shelter if necessary. And that mobile truck is, I'm telling you right now, is a great resource. So here's I gave you all the pros, right? The con is this. Unfortunately, a lot of our unhoused population, they don't want the service. A lot of them, and I can't tell you what percentage it does or does not. But when we encounter our population in that manner and we offer these services, a lot of times we do get turned down. A lot of times they don't want the service, and that kind of hinders our work, because it's like
Every city has its challenges, and San Gabriel is no exception, but it is through the passion and care of its community members that it continues to flourish. The city's cultural diversity and ethnic diversity may pose a challenge to future healthcare providers, but with the right heart and the willingness to listen, learn, and understand, there is so much good that can be done for the health of the community.